Absolutely. We think that having also male contraceptives will help decrease almost by half the unwanted pregnancy and the abortions. So I think it's very important to help men and women to control their fertility and decide together, hopefully, on the size of their family.
Hello and welcome to GB News Originals. I'm Lucy Johnston, and today we're tackling a subject that could transform relationships and family life here in Britain and around the world: the male contraceptive pill. For decades, the burden of contraception has fallen mainly on women who've had to cope with everything from daily pills to coils and implants, often carrying the side effects as well as the responsibility. But now, for the first time, we may be on the brink of a revolution in male birth control. Just this week, there was a report that revealed early trial results for a non hormonal male pill that appears safe, effective, and crucially, doesn't impact sex drive. If successful, it could be a real game changer. To unpack what this means and how close we are to seeing men finally share the load when it comes to contraception, I'm joined by one of the world's leading experts in the field, Dr. Régine Sitruk-Ware. Dr. Sitruk-Ware is a renowned reproductive endocrinologist studying hormones, and she's a driving force at the Population Council, which is a global nonprofit that has spent decades pioneering new contraceptives. She's led groundbreaking research into male and female contraception, including the development of a hormonal gel for men that is now in advanced trials. So, how soon will we see a pill for men on the shelves in Britain? And will men actually take it? And could this finally change the balance of responsibility between men and women in the bedroom? Dr. Sitruk-Ware, welcome.
Thank you. Thank you for inviting me. And I am very glad to see a lot of activities in this field and interest for new male methods. While, as you have said, the burden of contraception has always been the matter of, responsibility of women. So now we are about to see new products. Sorry.
No, I was just going to talk about the reports out this week, which is this big breakthrough, this new male contraceptive pill is meant to be safe and doesn't affect sex drive, which I think has been one of the problems to date. And can you just explain, really in simple terms, how important this is?
Yes, this is a new molecule that is intended to block the receptor of the vitamin A. Vitamin A is needed in many places in the body, but this one is very specific to the testis. So it would not affect any other function of the human body. And it blocks the multiplication of the cells in the testis, so it prevents sperm production. So the man would have their normal male function, male drive. However, they would not produce sperm. And this will help in the long term to see effective method for allowing the women to stop their contraception, and the couple will rely on that only method.
So the big question I think will be on many people's minds: how far gone, how far into these trials are we, and how far away are we from this becoming a reality? Because it's only in trial stages now.
This is the very first trial, and it's only single dose used by male volunteers, and that helped to show that there was no unwanted effects. But they need to conduct repeated doses and long-term studies, and that usually takes time. The, uh, even for developing female contraceptives, it's the same regulation requirements. To get approval by the health authorities, you need to document prevention of pregnancy, not only that you suppress the sperm. In theory, yes, when you have zero sperm, you cannot father a child. But the health authority are used to require studies where the couple volunteers for taking this method by the man and having normal relationship and have at least a full year of use, and then follow up for recovery to show that the sperm returns to normal. All of that is expected now for this product, given the studies in animals. And now in the human, they had this first study.
Hello, I'm Bev Turner. Now, it can feel like the money in our bank accounts at the moment does not keep up with the cost of living, and maybe there's a solution. I'm here today with the CEO of TallyMoney, Cameron Parry. Cameron, what is TallyMoney?
Well, Bev, with TallyMoney, you get a current account and a debit card, but instead of pounds, you use milligrams of gold as your everyday money.
So why gold?
Gold traditionally is a great store of value. It has, on average, gone up at over 11% per annum for the last 25 years against the pound. It's tripled in value in the last decade. And in the last 2 years alone, it's increased by 50% against the pound. Banks' savings products just can't compete with that level of growth.
But this isn't just about gold. This is about a currency that you guys have created at TallyMoney. Explain it to me as though I'm an idiot.
So, look, people need to be able to hold their earnings and build their savings in a money that retains its value and remains in their legal control and remains theirs to access, away from government control.
Great. You had me at not exposed to government control.
You should feel safe and happy with your money. You should have peace of mind. The more money you see in your bank balance, and that's the type of thing we're trying to deliver, and give people choice in the type of money they get to use every day.
Brilliant. Thank you so much, Cameron. Thank you.
Yeah. So, I mean, I presume it takes a bit of a higher burden of proof of safety and efficacy because you're not preventing disease. It's not something that people need to have. So is this why, do you think, one of the reasons why you've spent decades of your career researching the male pill or the male contraceptive, but why has it taken so long? Or do you think there's other reasons?
Well, it's true that, I mean, women have accepted some side effects just because a trade-off of the high benefits of not getting an unwanted pregnancy. Now, men are ready to accept some side effects, and you cannot have any new molecule without some side effects, like, headaches or tiredness. And this is something you see even in the general population. So, but the requirements for safety are anyway the maximum requirements for anybody. We do not want to create any side effects when we give a medication to a normal person who has nothing to treat anyway. So the surveillance is important, and the requirements is to have at least 1,500 subject men who would have used the product and no serious adverse events or,
And yeah.
unwanted, only minor effects would be accepted.
Some people say that women seem to take the burden very often in medicine, and maybe this is one of the reasons why the male pill has not been a thing. It's some kind of prejudices in the system or biases in the system. Do you think there's any evidence of that?
Well, we have seen changes in large surveys. I mean, a decade ago, the surveys showed that about 50% of men in several countries in Europe and the United States would be interested by taking a male method. And more recently, last year, there was a publication in the United States, more than 9,000 men interviewed. And there is a very much higher demand now. And they wanted to participate. They expressed their choices. The pill came first as their choice, but they also want gels because they do not want to depend on a health provider to inject, an injection, intramuscular injection, or some people prefer an implant, long-term action. But the majority, and I say up to 80% of the men interviewed were ready to take a male contraception. And the women interviewed say they would trust their partner to take a method, which is something also really important. So we
And a lot
see,
Yeah, a lot of women might say they're not sure they trust their boyfriend, or it might be a one night stand. They may not trust them to remove the pill, and obviously the burden falls upon a woman to either carry a baby or have an abortion or whatever. So, what do the studies tell us about whether men would use this reliably?
well, the method that are user controlled always require consistent use, daily use, like the pill. And, even women convinced that they do not want a baby, sometimes they forget the pill. So it may happen that men would forget. The difference is that it takes several days to produce sperm. It takes about 60 to 90 days to restore the full production of sperm. So if they forget several days in a row, then they would have a risk of producing new sperm and being fertile. Women, if they take a pill and they forget, they had 2 days and then they may reovulate. So the risks are different, you see. The
Yeah.
other important point was that there is no guidelines from the health authorities on how they would consider a new male contraception. Here we are in a situation where you give a product to a person, to the man, and you measure the effect on the other, on the partner. So you measure the first effect on the sperm production on the man, the side effects on the man, but the final endpoint, pregnancy, yes or no, is on the woman. So it creates new situation on how the regulators will approve the product. And that had explained why the industry was not that interested. So they first didn't see a big market because they thought men would not use the male contraception. And they didn't have clear guidance from the health authorities on what they have to do, what kind of studies that would be acceptable to the EMEA, the FDA, and the medical product agencies. So now we have seen this high demand. So a few small companies have been interested. And here you have seen in this paper, Your Choice Therapeutic, a small company interested and investing, and they are doing really good work. So we can expect in a few years, and I cannot give a number, a male pill to come. Before that, I think we would have another product coming first, which is the gel. Because this collaboration we had between the Population Council and the National Institute of Health in the United States was to develop the gel since 2005. So it's already 20 years we have worked on that, and we completed, as I said, a very large study of 462 couples volunteering. And 200 had completed a full year of treatments, 99% recovered. But now I can't give more results because we want to submit the result to the New England Journal of Medicine, and we cannot disclose the results before the publication.
So
Well,
this gel that you've been developing, which is different from the pill, is a hormonal based product. And right. And I gather if we could just very, very briefly talk about how that works. But that has faced some criticism for the possible side effects because of the hormone input. Do you think men are worrying about that as much as women have had to for decades?
Well, we have seen a high satisfaction by the people who have used these treatments, and it required daily application. It
On the
required
shoulder, is that
on the
right?
shoulders. Yes, they had, to put one dose, half dose on one shoulder, the other on the other shoulder, rub, let it dry for a few minutes, and the precautions to prevent transfer to their partner or to a child, not hold the child in their arms, while they had just applied the gel. Let it dry and cover the area. And it works by blocking the command from the brain to the testis and stop the production of sperm. So it's the same mechanism in a way of blocking the sperm, but also it blocks the testosterone, the male hormone. So we have to replace it. And this is why the gel contains two agents, two hormonal agents. One derived from progesterone, which blocks the full command. And the second is testosterone that contributes to the blockage and replace the male hormone. So they will have the same levels of hormone they need to have their male habitus, their drive and their libido normal. So everything has been really going well in this study. And as I said, the high number of people have accepted to get interviewed, and many say, very satisfactory result, because they say, when will it be available? Can I re-enroll in the study? And positive things. Now, people who were not happy with that or didn't like, the fact of having a gel, or either they did not enroll or they stopped early in the study because, the study was too demanding, or so we need to develop several solutions, several options. Women have some options. They have pills, they have patches, they have vaginal rings, and the men had almost nothing because, as you know now, they had condom or non-reversible vasectomy. But in the future, we will see and we develop methods that can satisfy different needs. Men who prefer to have a pill, or men who prefer to have a gel, or some would have an implant. There are some implants being developed, or having a reversible vasectomy, which is also in the works. So all of this is very promising for men and for the couple, because they will share at different times of their life. When they want to space, not have child at all, or having completed their family, and they can choose the method that suits their needs.
So do you think you mentioned it could be just a few years off? We don't know which one will win the race. Presumably, you don't know that at this point. Which is no.
The gel has completed the phase 2. So the gel has really is the first method,
Hormonal.
but we need to do the phase 3. And the phase 3, whatever new product, needs to make a large phase 3 or two phase 3, usually, one international in the United States. And And this takes at least 4 years because you have to enroll a large number, like 1,200 couples, and then follow them for the full year of treatment and the recovery. So that
So do you
takes
think this could sort of finally shift the balance of responsibility for contraception away from women, so it's not always them bearing the side effects and the stress? Do you think that that's important, and why?
Well, absolutely, because I think sometimes many women do not tolerate any of the methods existing, or they are really annoyed having to take every day something. And,
Side effects, the pill and mood swings. There's a link to some cancers, isn't there? And the inconvenience. So there are other things that women are bearing right now for the pill.
well, all the very large studies and have really indicated there is no real risk for cancer, or even it protects against ovarian cancer because it blocks
Blood clots as small as
blood clots in women who have other risk factors, some who are overweight or have family um, inherited changes in the clotting system. But still, I think this risk exists with many of the products available. It's a warning if they should not smoke, and the women who smoke more than 15 cigarettes a day and they are over 35 years of age, they have, not to use hormonal methods. IUDs are very effective, but if it's the simple IUD, they may have heavy bleeding, so it's inconvenient. But I use there with that. Yeah.
Yeah.
And
Okay.
why it's very good news that men would have some choices.
Yes, it is. So we know that half of all pregnancies worldwide are unplanned. And do you think this will make a serious dent in those numbers, or could do, in the UK and globally?
Absolutely. We think that having also male contraceptives will help decrease almost by half the unwanted pregnancy and the abortions. So I think it's very important to help men and women to control their fertility and decide together, hopefully, on the size of their family.
But some people say, and I was talking to my daughter and her boyfriend about this last night, they're in their 20s, and they were wondering whether, some men might just not take it. It doesn't matter to them. They could just say that they are, but they're not going to shoulder the responsibility, or that women wouldn't trust them to take it. Do you think that that's an unlikely scenario? What would you say to those skeptics? Because
Well,
it's not all on them. Yeah.
I think it will when people will see that it works and they speak to each other and news come out of this method and how effective it is, uh, they speak to each other and they get interested. And let me give you an example. Vaginal rings became very popular, and people say women will never use it. They will uh, not be a market for that because they will not use something in their vagina. And then we have seen changes. So I think for young men, they are not very secure. There are also the protection against transmitted disease. So the condom has this advantage that they would not have with other methods. So it's important also to see that aspect when they are young and they are not really in stable relationship. But from the moment they are in stable relationship, I think this method will be very popular.
Can you talk just about some of the possible side effects of the hormonal gel which you're developing, and just tell us how long you've been looking at this research? How long has that been in the pipeline?
Well, it has been in the pipeline since almost 2 decades, and we had done a lot of dose finding. many toxicology studies in animals. So we have really demonstrated the safety of this product. And what we have seen in the very large study just completed, there was no serious adverse event. So that was very important. And there is minor events, like headaches, some weight gain, but all of these side effects were less than 5%. So, I mean, it's very small incidence, small number of occurrences of this.
Extra and mood swings, that was one.
Sex drive, no. I think we had a few with libido decrease and a few with libido increased. And only one person had discontinued the treatment. So we can see the reasons for discontinuation, which are the most indicative of the importance or the relevance of the adverse event for the person. And acne is something that occur because of the androgen, but people who have been already having acne, they can have seen worsening of acne. And mood swings, yes, we have seen some 10%, 12%. I mean, I can't give you precise number. I told you this is still uh, uh, being published. We are finalizing the analysis. So, but what I can tell you that we had no serious adverse events, and most of the small, not small, I mean, how can I say, minor side effects we have seen are either mild or moderate. And
Great.
the acceptability was great.
You wouldn't want to compare the different types of male contraception. So we've had the news about the pill, which is non-hormonal. It's meant to be free of side effects because it's targeting a protein as opposed to changing hormones. But you wouldn't want to say which one you think would be safer, more effective. It's just different methods. And is that right? And you perhaps see that that all of
Different approaches. It's different approaches. And the pill is at the very early stage. You do not know what will be seen when you have, 1,000 people taking it and, people with themselves. These volunteers that came into the study, they were absolutely normal with no history of depression, no history of whatever. And so you can see that they have no side effects. So it's early, so we cannot really say that there will be nothing. And
that it's happening. You must be very excited to see this after decades of research. Did you ever think you would see the day that it would be just years off and that it's within reach?
yes, really indeed, because we have started the large congress on male contraception in 2016. So, and at that time there were very few things available, and we have seen the progress. And in this last decade, really great progress, plus a high demand and men interested in the field. So I think that was the big step.
You don't know why they were less interested before and more interested now. Any ideas?
Well, I think the people read more, they have more information, and the social networks, they exchange more. And the I think the age groups also have different views, and the young people, according to the age group, they might be more willing to share responsibility. Some very young, they don't care, they don't want to care about. Older people may say, "Oh, that's the business of the women." So I think,
On the attitude.
but I think the attitudes have changed, and that is a good thing for this recent years.
Absolutely. Well, Dr. Régine Sitruk-Ware, thank you so much for joining us and sharing your insights. And so what we've learned is that this contraceptive pill, a male contraceptive pill, is no longer a distant dream, and it's edging closer to reality. So thank you so much for talking about that. For too long, I think women have shouldered most of the burden and choice. So we really welcome your new research that's out soon. Thank you so much for joining us.
Thank you. It was great talking to you.